Welcome to America's Heroes Group, with information and resources that's disseminated intentionally to empower our military population. With host Vietnam veteran Cliff Kelley, co-host Iraq veteran Colonel Dr. Damon Arnold, and co-host Army National Guard veteran Sean Claiborne. And now, America's Heroes Group.
We have in our chase bags, we have a care package of hygiene, we have shaving equipment, we have razors, and for the women we have the same personal hygiene items for them as well. And we want to say thank you for their service. This is Chase Bank. Thank you very much.
People in the neighborhood, free haircuts, the service, the food. Look good. Thank you for your service. Thank you for your service.
Thank you for your service. Okay.
On behalf of Cliff Kelley, America's Heroes Group, we sincerely thank Chase Bank.
VON, it's America's Heroes Group, hosted by Cliff Kelley, with co-host Dr. Damon Arnold and National Guard veteran Sean Claiborne on the Talk of Chicago, 1690 WVON.
Afternoon. Welcome to America's Heroes Group on WVON 1690 AM, the Talk of Chicago. I am Vietnam veteran host Cliff Kelley. America's Heroes Group is a live streaming podcast, global platform, radio, print, and digital media broadcast show that empowers change agents through intentionally disseminating information, resources, and referrals to empower our military population.
And with that, welcome to America's Heroes Group, our roundtable and our partner, Hines VA, particularly in women's health care. Today is Saturday, October 15th, 2022. October is Breast Cancer, Mental Health, Natural Disability, and Domestic Violence Awareness Month. Our host is Cliff Kelley, just heard at the top of the hour. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have, on the topic of Domestic Violence Awareness Month, we have Erin Hanrahan. She's a licensed clinical social worker for the Intimate Partner Violence Program, the IPV, and the Assistance Program Coordinator for Strength at Home. And she's also a certified coordinator and regional trainer for the Strength at Home program. How you doing, Erin?
I'm doing great. Thanks for having me.
So let's talk about these programs and also the White Ribbon Initiative. So one of the things I wanted to bring up is you seem to have a passion for helping people. You've dedicated your career to helping people who are in bad situations, who are prone to violence and taking it out on their domestic partner. Tell us about these programs, what that is all about, and what it's doing to try to help people in these situations.
Yes, again, thanks for having me. And as you already mentioned, October is Domestic Violence Awareness Month. So at the VA, the Intimate Partner Violence Awareness Program, our theme this year is building relationship health and safety for life, which aims to increase awareness of the critical importance of healthy and safe relationships throughout a person's lifetime. So our mission at our Intimate Partner Violence Assistance Program is to provide comprehensive, person-centered, recovery-oriented programming to veterans, their caregivers, families, partners, and VA employees who are experiencing or using intimate partner violence.
So from what I understand, so 1 in 3 women, 1 in 4 men have a situation where they might have a partner where that's abusing them in one way or another. But for the military population, that's twice as likely. So what are some of the problems around domestic abuse? We need to see how pervasive it is. What are some of the extra challenges that military experience provides that creates that increased risk?
Yeah, so we know that strong protective relationships are a protective factor. And so oftentimes when relationships are underneath stress, that can actually start to break down the relationship. It can actually increase impulsivity, and then again, create relationship stressors. So oftentimes there are specifically, our program again is designed being person-centered, recovery-oriented. We really want to target the behavior and the relationship stressors that are coming up. So we know that our veterans have had very unique experiences and stressors. And some things, while these are not indicators or causes of IPV, we do know that there are some co-occurring indicators of IPV. And that can be post-traumatic stress disorder, it can be mental health concerns, it can be TBI, and also substance use. So just the difficulty kind of tolerating anger. And so when these factors, are occurring, that also then tends to break or add stress to the relationship, and so can to increase the possibility for intimate partner violence.
So who's eligible to get care or get help in the veteran population?
Yeah. So again, our program is comprehensive. So we provide services directly to veterans, their partners, and that can be a spouse or a dating partner, caregivers, and then VA employees. And the specific services that we offer within our intimate partner violence program are screening. So we do safety and wellness screening, we do assessment, we do education, we provide prevention. If somebody is experiencing relationship distress or IPV, we can do some safety planning, we connect them with resources in the VA and outside of the VA, and then we offer some very specific interventions. We also individual counseling, group counseling, and then couples therapy when indicated.
So walk me through this process. How does someone, because I know a lot of times when you have people that are inside of a domestic violence situation, they have a very difficult time speaking up and having that encouragement to step forward and say something. So how do you encourage that someone to step forward and say that hey, I'm having an issue with someone at home?
Yeah, so sometimes when we're experiencing relationship distress, we may not identify it as intimate partner violence or domestic violence. So an individual knows their relationship and knows what's happening and how that might be impacting them. And so part of me coming on today is really to raise awareness that we have this program, because many people may not be aware, for one. Also, who is eligible. So again, veterans, their partners, caregivers. So again, wanting them to know that services are available. People can be referred to the program, again, when they're ready. They can either, if a veteran, they can get a referral from their provider within the VA, or people can self-refer. So what I want people to know is that I'm available. My direct line is 708-202-7243. So somebody can directly call me. And again, part of this is really on when somebody's ready. Maybe somebody is just wondering about their relationship. And again, having somebody to reach out to get some education and some support is sometimes initially the first step. So again, I just want people to know that we are available and that we are here. And lastly, I guess what I'd want to mention when I was mentioning about the specific services. So depending on who is the individual calling to receive those services. So specifically for veterans, we have 3 programs that I just want to briefly mention. We have RISE, which is an individual evidence-based treatment for those that are experiencing IPV or relationship distress, that they can get some individual counseling. It is brief. We also offer our Strength at Home program that you referenced in introducing me, and this is an evidence-based 12-week group intervention for veterans that are using anger, aggression, or violence within their intimate partner relationship. So again, this is a very small group of veterans that can enroll in a group treatment. And then we also have our Strength at Home Couples program. And this is an evidence-based 10-week group intervention for veterans and partners. So it would be the couple that would join this group. And this is really designed to work on communication and reduce conflict that's happening among the couple.
And one thing I thought was interesting about Strength at Home is that it focuses also on the person committing the abuse. And the person committing the abuse could be a man or a woman.
Yes.
So what triggers or what event has to happen, the how or the when or the what, to make someone realize, hey, you know what, I have a problem? Because usually we think of especially in Hollywood and social media, we think of the abuser as like some big, macho guy that, is headstrong and he drives really fast and reckless in his hot car, and he's always, being abusive to everybody and being mean to everybody.
Right.
But that's not always necessarily the case. That stereotype is not necessarily true.
Right. Yeah, so we know that both males and females can experience and can use intimate partner violence, and again, affecting the relationship. So specifically with our Strength at Home intervention, this is a program that has been designed and tailored specifically for veterans. So it has been offered at Hines VA for the last 6 years, but with the development, this was really done with lots of effort from our National Center of the PTSD Clinic and the Department of Veteran Affairs to create this program specifically, and we are the only program designed specifically and tailored for veterans. So really, we, and you'll oftentimes hear me today or beyond, I'm using the language that those that use intimate partner violence and those that experience. We really want to target the relationship behaviors and let go of that language and that stigmatizing language. So veterans who can enroll in the Strength at Home program, again, may not identify with what we see oftentimes are those labels in the community. But if they're struggling with the relationship, and they notice that they're using anger or they're having a difficult time communicating and it's coming out more in an angry or aggressive way, then they would be appropriate for this treatment. So
let me interrupt for 1 second.
Designed...
So what are some of those stigma or those terms that people might think of as being a stigma?
Yeah, so oftentimes we hear perpetrator, abuser, for those that are using anger and aggression within the relationship. And then on the other hand, those that are experiencing relationship distress or those that are experiencing violence in the relationship, oftentimes people refer to those individuals as survivors or victims. And that language is not recovery oriented. Oftentimes people, especially those that are experiencing IPV, may not want to be identified as a victim or a survivor. So the VA endorses different language. We use language that is inclusive to kind of really target behavior. So again, it's veterans that are using anger and aggression or those that are experiencing. So again, we really want to target those relationship behaviors that again are having an impact together on the individual and on the couple.
Circling back to that question a little more deeper. So, what triggers a veteran or someone who's the person who has the anger issues? What triggers them to want to get help? Because it seems like if you're in that situation where you're the one that's the instigator or the person who has the anger issue, that oftentimes you're doing it and don't want to change. There's usually resistance to change. So what usually triggers that change or a desire to get help?
Yeah, so oftentimes it could be the partner is, kind of maybe, having an ultimatum that the relationship, identifying that and understanding that there are these stressors. And oftentimes, in my experience, veterans have been able to identify that they're responding and engaging and responding and communicating, having a difficult time communicating and using anger within that relationship. And again, it can be from verbal just to, maybe making comments that are insulting or name calling up to using actual physical aggression. So there is a continuum of behaviors. And oftentimes people can identify whether it's being pointed out by the partner or even by individually by themselves to kind of recognize that they might be handling their stressors in a way that is not helpful, in a way that is harmful to them and harmful to their partner. So again, letting them know that this is a program that is available to them, which is why we look at, and one thing that I do want to actually kind of step back and be inclusive about is veterans who are either at risk. So if they kind of feel like they've been struggling for a while or feel like they oftentimes feel like they potentially could use anger and aggression, they would be appropriate to enroll in this treatment and intervention as well. So again, it's really looking at their relationship and being able to identify that there is a breakdown in kind of how they're dealing with stressors, or maybe the difficulty in communicating, or the first way that they find that they're communicating is, again, having this emphasis of just low frustration and anger. Again, it could escalate to aggression and violence. We offer this program and want veterans to know about it because we feel it's an early intervention. We want to prevent it getting to a place of aggression and violence.
Mm-hmm. So if a person is on that, how do you recognize if you're in an abusive versus or an unhealthy relationship?
Yeah, so there's a lot of indicators that can help people identify that they may be experiencing violence or aggression. So oftentimes, if somebody is very controlling around what you do, what you wear, where you go, that can be an indicator. Again, some pretty clear ones are using physical aggression towards somebody. But again, we look at even those milder forms that are like, insulting the partner, name calling, yelling, intimidation. So any form of intimidation, even any kind of aggressive behavior. If throwing a chair or throwing a phone happens, that an individual may not necessarily identify that to be aggressive or violent, but on the partner side, somebody who's experiencing that can be intimidating, that can be threatening. So behaviors like that are things that people want to watch out for, and if they're experiencing those things, they could be experiencing intimate partner violence or, again, aggression or violence within the relationship. And so I just, again, want people to know that when in doubt, I want them to reach out and know that there is somebody here that they can talk to.
Now, does the dynamic change? Because so far we talked about like the initial buildup of something that might get to a situation where it becomes physical. Does the dynamic change when children are involved? To say there's children in a relationship, maybe it has escalated to where it's physical, or even maybe not even physical yet. Does that change the dynamic, and does that raise the urgency for maybe intervention?
Yes, for sure. I mean, we know that adults, so as far as with domestic violence, these are adults that are in a relationship that are struggling and having relationship discord. And then, again, that can look like in many different forms. However, when children are involved, children innocently are being impacted whether the couple realizes it or not. So children witnessing anger, aggression, or violence within the home or within this relationship definitely has an impact on their mental health, definitely has an impact on their emotional health, their well-being. So it definitely is a higher risk factor that we want to look at. And I oftentimes will have conversations with veterans when looking at the impact that their children might be exposed to with the relationship distress. So that oftentimes can be a motivator even to looking at themselves and getting help, because surely I think oftentimes our children are a protective factor, they're important to us, and so veterans can oftentimes, when recognizing the impact that can have in children and in the home, that can be a factor to kind of ask for help and intervene, because again, those are the children, their parents are their role models, and so what they're witnessing again has a direct impact. They don't necessarily have to be experiencing violence or aggression directly, but the exposure of it definitely has an impact on their emotional and well-being.
So a lot of times when people, going back to the idea of having children in their households, a lot of times people that are experiencing the anger, or experiencing the violence, or experiencing the not to use the word, getting away from the word abuse, but experiencing that negative interaction, unhealthy relationship, a lot of times they don't speak up and don't say anything because they're worried about the kids. They're worried about what will happen to the kids. They're worried about losing their kids. They're worried about retaliation from the person who's being aggressive or angry. So how do you overcome that to encourage them to get help, and what tactics or ways or strategies can they use to try to seek help? At least getting that ball rolling, get that situation, getting the situation for help started.
Yeah. So the first is reaching out and talking to somebody, because I think oftentimes when I'm working with people, it is designed around about a lot of education, the impact that they're experiencing, even if this is somebody who's using aggression, of course, the impact that somebody who's experiencing, but again, the impact in the family, and then being able to kind of look at all of those areas. And so it is about, reaching out and kind of getting, knowing what is available. So I think that, by having a conversation about the current distress that an individual veteran or their partner is experiencing, oftentimes one of the things that we'll do is some safety planning. And so if a situation that they're involved in or is dangerous or is of concerning to them, we're going to do some safety planning around that. And that also includes some safety planning around the children. So what can you do if you are in a relationship that you are experiencing anger and aggression? How can you keep yourself safe? And I think you're right. Not only are the children concerned or fearful of speaking up, but individuals who may be in a relationship may not know where to turn or how to ask for help or know that help's available. So these are careful and delicate conversations to make sure that an individual has as much education. My role is to really stand beside somebody, whether they are experiencing or using, to help them know that there are choices, there are options, and there are resources available to them. Because truly, domestic violence, intimate partner violence is preventable.
So in order to access this type of help, do they have to go to the facility? Do they have to go to the VA, or can they access it through a phone call or teleconferencing? Maybe they live far away from the VA. How do they get access?
Yeah, great question. So we offer all. So we offer in-person, we offer virtual care. So that can be through our VVC program that veterans may be aware of, our virtual care program, and maybe even offered by the phone as well. So all of those options are available to veterans or to their partners. And we do know that we've got many veterans that are further out from the medical center. So again, taking in that consideration, we do offer virtual care and have for a while, and that's gone really well.
Okay. So we're running out of time, so we have just a minute left. So we want to just want to make sure people know that this is something that's available to them. So we talked about a lot of things that can help people get help and reach out to something that is available to them, and you can do it discreetly. You can do it without your partner, maybe enraging or infuriating your partner for doing it. And start the ball rolling. Get the help that you need, so that way you can get protection. Because if your kids are involved, it's really, really important. I think you brought up some interesting things. Tell us one more time the phone number for how to reach you.
Yes. Okay, so veterans, partners, if you're experiencing relationship distress, if anything I've said has been of interest, please reach out directly to me. My phone number is 708-202-7243. On my voicemail, I also have the Illinois and domestic violence hotline, those are 24/7, that you can speak to somebody if I'm not available. Again, I just want you to know that domestic violence, intimate partner violence is preventable, and we have lots of support and resources. We are here for you. You are not alone. Help is available. Also, I'd encourage you to check out our Hines VA website for information, and we also have our IPV public-facing website, and that's www.socialwork.va.gov/IPV/index.ASP. And that is our public-facing website. You can get more information.
Erin Hanrahan, thank you for your time. Licensed clinical social worker, partner of IPV, the Intimate Partner Violence Program. This is America's Heroes Group. We'll be right back.
Thank you so much.
Welcome to America's Heroes Group, with information and resources that's disseminated intentionally to empower our military population, with host Vietnam veteran Cliff Kelley, co-host Iraq veteran Colonel Dr. Damon Arnold, and co-host Army National Guard veteran Sean Claiborne. And now, America's Heroes Group.
We have in our chase bags, we have a care package of hygiene, we have shaving equipment, we have razors, and for the women we have the same personal hygiene items for them as well. And we want to say thank you for their service. This is Chase Bank. Thank you very much.
People in the neighborhood, free haircuts, the service, and food. Look good. Thank you for your service. Thank you.
Welcome back to America's Heroes Group, this time with our Roundtable Community Outreach and our partner, the American Institute of Dental Public Health, AIDPH. Today is Saturday, October 15th, 2022. October is Breast Cancer, Mental Health, and National Disability and Domestic Violence Awareness Month. You just heard our host at the break, Cliff Kelley. I'm Sean Claiborne, the co-host, Army National Guard veteran. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have a partner on the line and on our Zoom and YouTube. That is Dr. Annaliese Cothron. She is a co-founder and executive director of the American Institute of Dental Public Health. She manages the program fund development and overall strategy of the AIDPH. And we're talking about updates and information on dental care. That's something that's been on a lot of people's minds because a lot of us want dental care and don't have it. So she's going to talk about that and also give us the importance of how it affects our health. How you doing?
Hey, Sean. It's so good to see you again.
Yeah. No time no see.
Thanks so much for having me.
So one of the things I think is important, explain to everybody, and also the powers that be, we're talking about government, we're talking about the legislators and all the executives out there, how important is dental care to your regular everyday health? Things beyond what's going on inside your mouth.
Yeah, it's actually critical to your whole body health. And you know, I still don't get why we pretend like the mouth isn't a part of your body and, you know, therefore it doesn't impact the rest of your total health and well-being. But I think we all know just from common sense as everyone being a patient, everyone having a mouth and understanding that our dental care and our oral health is critical to feeling good, right? I mean, we can have pain in our mouth and that is excruciating. It's uncomfortable. It leads to unnecessary visits to the ER. That's also connected to opioid usage. And so we know that, yes, there's some obvious mouth and teeth issues, but we know that our mouth is also connected to chronic disease conditions throughout the entire body. That's a big piece of what AIDPH has been promoting as part of our whole person health and putting the mouth back in the body, especially for veterans, is awareness around connecting oral health to chronic disease conditions. And so what we know is that veterans are disproportionately impacted by chronic disease conditions like diabetes and heart disease. And that can exacerbate poor oral health and vice versa. Poor oral health can exacerbate those chronic disease conditions. So a big piece of our awareness and frankly our research has centered on understanding how veterans are experiencing their oral health and understanding how they're experiencing chronic disease conditions and measuring outcomes that connect the two.
So to be clear for people, and people that haven't got on Medicare yet, I'm not on Medicare yet either, but when you go to Medicare, there's no dental coverage on Medicare. If you want to get any kind of dental coverage, you have to get a Medicare C Advantage program, which most people don't like to get on because of the restrictions and so on with that. If you're a veteran, you can get dental care, but there's a lot of qualifications and a lot of eligibility requirements you have to meet before you can get dental care. Can you go through some of those with us and kind of give us an idea about how difficult it can be to get dental care as a veteran?
Yes, actually, this is something that I found a lot of people don't understand, although veterans themselves certainly understand it. So when you look at the eligibility criteria, first of all, the eligibility criteria for VA dental coverage is set by Congress. So that's through federal code, through priority groups, and they determine who is eligible for what types of care through the VA. And what it works out to is about 85% of veterans don't meet the eligibility requirements to get dental care through the VA. And of that 15% who do meet that really limited, and essentially what that boils down to are veterans who have 100% disability rating, or a small percentage of veterans who have some sort of mouth or oral condition that are connected to needing VA dental care, but that's very, very small. Those who qualify for that are very small. The majority of that 15% that are eligible are 100% disabled veterans who have a disability rating of 100%. So of that 15% who are eligible, we know that only a third of those actually utilize the VA benefit. So we have kind of this really complicated issue of, one, most veterans not qualifying for VA dental care, and two, even among the veterans who do qualify for VA dental care, they're clearly still experiencing issues with just getting in to see their VA provider for dental care. That might be because they don't have a VA dental clinic close to them. It might be because the wait times are long. It may be because they genuinely don't understand their benefits. One thing that we asked in our survey in 2021 was just a really simple question. We found that there was no data available to us on oral health care for veterans. And that's largely because the VA doesn't provide dental care for veterans, the 85% of veterans. And so the VA doesn't have that data. That's why we took it upon ourselves to research and understand how veterans were experiencing their oral health care. And so when we asked veterans just really simple questions, where are you getting your dental care? Most veterans are getting it from private practice or not getting it at all because they can't afford it. And then when we asked them, do you understand your benefits? Do you understand if you even have access to dental care? 42% of the more than 2,000 that we surveyed said they did not know if they had dental care through the VA. So it's really complicated. Most veterans don't qualify for dental care through the VA. And then if you do qualify for it, there's a lot of reasons why you may not be accessing it.
Is government scared of changing a convoluted and archaic system? What is it with? Why are we still having this conversation 100 years later since we were amputating like Civil War soldiers in tents with mosquitoes and bugs and typhoid everywhere? We're still in this ancient healthcare system, and you would think that we'd have something figured out by now. So what is the resistance, or what is the problem why we haven't gotten this stuff straightened out yet?
I wish I could answer that. Quite frankly, the issues that I'm bringing up with dental care for veterans, I think we all know applies to most Americans. Like, the entire dental care system is in a silo. Most people are not accessing it effectively. Most people are experiencing inequitable oral health care. You have a separate insurance system for dentistry than you have with other forms of primary care. And I think why we've taken this issue on with veterans is because we feel like veterans deserve equitable access to oral health care. Veterans have invested in their country, and they deserve to get access to dental care that is affordable and effective and high quality. And I think to your point, I've been asked the question before, is the VA even the answer, right? I know AIDPH has a stance on saying any expanded access to dental care is a win, and that includes through the VA or, any other opportunities to expand dental care. And why I think we're positioning the VA and really championing for the VA to expand eligibility is actually back to that initial conversation where we started off by talking about how oral health care is connected to the rest of the body. So the VA is actually the largest integrated healthcare system in the nation. Wow. And integrated means that you're able to get all of your health care essentially in one place, or at least it's connected in the same system. So if a VA provider for, your diabetes or just, your family provider, your general practitioner, they're actually able to look up your record and see other providers that you've seen, see, what other health care you've been able to get within the VA system, and then inform their treatment plan by that. And so that's actually really important when we're talking about how oral health is connected to the rest of the body, because the VA is the best position to give holistic care. And for some reason, I guess for congressional reasons, the VA has not been able to expand that eligibility criteria. So while I think, yes, of course, this is a broken system, we can all do better, we can all treat veterans better. At the end of the day, I do think if we're able to expand eligibility, that the VA is actually really well positioned to give veterans really effective care that's holistic and comprehensive and integrated. And according to the VA's own numbers, they can do it at half the cost of what happens in the private sector.
Wow.
So at the end of the day, this is all, taxpayer dollars. And if we're talking about cost-effective care that creates savings for taxpayers, the VA says that it is the best position to do that.
Wow. I want to go over some of the things people don't maybe not know about you. So some of the things that you've done, because you've been really, really busy in your career. So you're the co-founder and executive director of the American Institute for Dental Public Health. That is, we mentioned that earlier. You're also a board member for the Texas Impact, which is an interfaith organization. You're also on the Texas Oral Health Coalition. You're an active member for the Dental Informatics section of the American Dental Education Association, the American Public Health Association, and a board member of Equality Texas. So with all that and your experience, how close are we to cracking this or getting at least the ball moving closer to more equitable dental care for veterans? Particularly in light, and I have to add this as a caveat, when you look at other countries, they've already kind of incorporated this. This is not something that's revolutionary or new. It's common around the world. And we have a lot of ways we could do it. When you look at the numbers, look at the math, talk to economists, I've talked to people, experts in the field with healthcare and the money behind it, what cost it would take. We could actually do it very cost effectively, like you mentioned, and it could be done many different ways.
That's right. Yeah, I think in general, the U.S. is pretty far behind other developed countries when it comes to healthcare, and frankly, our outcomes show that, right? So we know when we compare the U.S. Health outcomes to the amount of money that we spend here in the U.S., we are not getting a return on our investment, right? And that applies to all of our healthcare systems across the board. So VA, Medicaid, Medicare, even private insurance. And that's probably for a lot of different reasons. And I appreciate you highlighting the work that we do here in Texas. So I run my own nonprofit, and we're a national nonprofit. We're national in scope. But we also believe in state-based advocacy. And Texas is the second highest number of veterans. We're almost tied with California at this point. And so it's really critical that states also be able to figure out solutions for advancing health care, dental care, in what they can control. Because as you mentioned, these systemic issues, it's really hard for anybody to make change. I think we've actually got a lot of momentum going, which is great. I know that we, AIDPH and our veteran service organization partners, which includes the VSW, which includes minority veterans, which includes the American Legion, which includes disabled American veterans, I think we're doing everything that we can do to ensure that we're connecting the dots at the federal level to inform policymakers on where they need to go. But there's lots of opportunities on the state level. We've seen that here in Texas. You can expand Medicaid to include dental care for veterans. And Oregon actually just successfully did this. I know in Iowa, they actually have a trust fund that they built out with legislative dollars that gives out grants for dental care for veterans when they need it. And so there are lots of different solutions that we can do right now to fill in the gap when we're waiting for federal lawmakers to really advance this equitable oral health care for veterans across the board. But here in Texas, we have a legislative session coming up next year at the very beginning of 2023. And I'm really hoping that lawmakers recognize an opportunity here because actually by expanding dental care for veterans, again, going back to those original points about cost savings, when you're talking about giving routine access, when you're investing in prevention, in the end, it's actually saving taxpayers money.
Wow. So one of the things that I noticed also too that's really important to you is the equity when it comes to particular issues with people who are transgendered, who also seek dental care. I didn't realize that was an actual issue. But there is issues with, and I should have, and one clue to this, my own story, I remember I was trying to get a wisdom tooth pulled. I had a cavity I found, and I went to this doctor, was close to my house, pretty expensive doctor, and one thing I noticed when I was sitting in his waiting room, that there was probably at least I don't know, probably 75% of that room were transgendered or LGBTQ people waiting to get dental care. And this guy was like supposed to be one of the best guys in like Chicago. This guy was supposed to be like, rock star or whatever. I was like, well, geez, these guys, everybody's getting this dental care from this guy. It must be really good. But what are some of the challenges of people who are transgender trying to get dental care? And what are some of the unique things that have to be considered when you're getting dental care for people in that group?
Oh, I'm so glad you brought this up because it's such an important topic. And we actually partner with, again, Minority Veterans of America, and they represent a huge constituency of LGBTQ plus veterans. And the executive director of that organization is transgender, non-binary. And what we've really done as an organization is invest in trying to understand those unique needs and experiences. And so what we do know, number one, is that queer folks in general, including LGBTQIA veterans, feel stigmatized before they even get to the dental office or to the medical office. And that usually means that they hold off on getting care at all until it becomes an issue, right? So it may mean that because they are fearing discrimination, they're fearing stigma, it's a process of having to come out over and over again when you're talking to a medical provider or a dental provider. And so you may just avoid going to get your needs taken care of. And that usually means that they get worse. So by the time that you do visit a provider and you're there in their office, you may be already experiencing pain. That means your costs are going to be much more expensive compared to, non-LGBTQ plus people who may not have that barrier of experiencing discrimination. And then what we also understand too, especially around transgender veterans, is that, again, this healthcare system is so siloed and dental insurance is so separate from other types of insurance that when you get into the office, you kind of have this whole cultural barrier. Is that dental office going to call you by your authentic name, going to use your authentic pronouns? Are you running the risk of being misgendered? Do people there kind of understand how to treat you the way that you should be treated and how everybody should be treated, which is personalized, customized care that's supporting your individual needs? And again, this isn't newfangled. We believe that every person who sits in the dentist chair should be getting that customized patient care experience. And in fact, we also recommend that every single dental care provider should be asking, have you ever served, right? That any person sitting in their chair, we know that women veterans are less likely to be asked if they've ever, served in the military, just because there's an assumption that women are not veterans. Same thing with queer veterans, LGBTQIA plus veterans in general. So we think that customized patient care experience can happen across the board to include LGBTQ plus veterans. And so it's actually really critical that folks invest in this type of care and ensuring that you're bringing a specialized patient care experience. And the last thing I'll mention, too, is that the VA is actually the largest provider of LGBTQ healthcare in the nation.
Wow.
So it's the largest provider of integrated healthcare, but it's also the largest provider of LGBTQ plus care. And the VA, I was actually just at the Minority Veterans of America Summit, which is going on today and tomorrow, and the secretary of the VA presented there and actually talked about transgender healthcare within the VA. And they're releasing all kinds of new guidelines to promote more inclusive, effective health care for LGBTQ plus veterans across the board. And so I really applaud the work that they're doing in the VA to ensure that all veterans are treated with dignity and respect.
So what benefit does it, so a person comes into a civilian dentist office and and the dentist asks if they're a veteran, how does that help the veteran?
Well, number one, I think it makes you feel respected and honored and that your lived experience matters to that person. So we always say, whether or not you think it's cheesy, it doesn't matter. If somebody says, yes, I am a veteran, you should always respond, thank you for your service. I just think it's one of those ways to make your patient feel like they are respected and that they matter sitting in front of you. But more importantly, for the patient care experience, I think you should also invest in what's called trauma-informed care. And this is actually best practice kind of across the board. But for veterans in particular, we should be investing in ways to make veterans feel comfortable who may have experienced trauma. And trauma can be combat related. It could be related to your military service. I know one example of trauma that some veterans may not realize that they even went through, but actually does impact their dental care experience today, is your experience of getting your wisdom teeth removed in boot camp. I know so many veterans who
I tried to get my wisdom. It did not work out.
You did.
It did not work out at all. I was given Motrin to send back to the barracks. It didn't work.
Yes, so this is a really common patient care experience. I know it happened to my husband, who's a Purple Heart recipient, and he was in boot camp. He had his wisdom teeth yanked out. I don't think they even had like anesthetic or anything, and he had to go on like a 20-mile hike the next day. And I've heard the same thing happen over and over and over again. And then to your previous guest's work, we know that there are victims of sexual assault who have been in the military, and being in a dental chair is it can feel invasive, especially if you've experienced trauma or you've experienced pain, like dental pain. That can feel invasive when someone's putting their hands in your mouth. And so signaling to a provider that they should take some extra care and cultural competency in providing care. We're not talking about anything that's hokey or over the top. We're talking about really simple things that people can do to make patients and veterans feel more comfortable in the chair. That includes saying, asking for consent before you touch somebody, like, hey, is it okay if I, put my hand in your mouth? Explaining very clearly what you plan on doing and why you plan on doing it. It's really about consent and ensuring the patient feels comfortable. Don't do things if the patient has experienced discomfort. And these are super, super simple. You would think that every, provider would invest in these kind of really simple techniques, but it's actually not as commonly used as it should be. And it can really mean that a veteran who's sitting in a chair who already has some discomfort may never come back to the dentist because it could trigger something. And we believe it's really important for veterans to feel comfortable, confident, and able to feel empowered after they leave that dental visit to then take care of themselves after the visit, because the majority of oral health is happening between those visits. It's not happening in the chair when you're talking to a dentist. It's that you feel good about yourself and confident enough to ensure that you're keeping your hygiene up in between dental visits. And so actually that's the crux of our newest survey that we just released this week, is really trying to invest in understanding that care experience that veterans have had. So whether or not you've experienced trauma, whether or not you've experienced discrimination, whether or not you are getting high quality care. Because what we found is when we do advocacy, either at state or federal levels, that we have some data now that we can work with to say, here's the cost savings, here's the disease prevalence, here's the opportunities to invest in good policy. But what I think we're lacking still is the story. Mm-hmm. I like to tell people that all of the numbers that we have represent real veterans who have real care experiences. And we want to represent your stories and your voice. And so we do that, one, by ensuring that we're always partnered with veteran organizations. So veteran service organizations are at the table helping us create our research. They get copies of all of the data. And then when we sit down to talk about interventions and solutions, veterans are always there to inform that. So we take a really transparent approach to our research and ensure that the data goes right back to the veterans. And so that's why we're investing in this second survey in 2022. And it's really to ensure that we have all of the context that we need when we go to decision makers to say, you should be prioritizing veteran dental care, and this is why.
Now, how can people access these surveys?
You can access our surveys at AIDPH.org/veteran oral health. And so right at the top, you'll see our 2022 survey. You'll actually see a few things on that page. Right at the top, you'll see our veteran oral health survey, and you'll be entered to win a $50 Amazon gift card if you do take that survey. And we hope that you do, because it's really important to ensuring that we can help you and help veterans like you get the care that you deserve. The other things that you'll find on that page is how we've invested in publishing that research. So you're going to see our publications on rural veterans, on the economic benefits of providing veteran dental care, and you're actually going to see our veteran oral health data dashboard that has information by community and state level too. So if you're really interested in seeing what veteran dental care looks like in your state, then you're able to actually pull out those community insights. And our ultimate goal goal here is to democratize our data. We don't want to hold on to data. We want to ensure that we're putting insights back into the hands of veterans so that they can advocate for themselves.
And also be clear, when you go and do these surveys, you don't collect personal, intimate information. You're basically putting in information and it's pretty much anonymous. That's
right. I'm so glad you clarified that. We don't collect any identifying information. And if you do choose to enter into the raffle for a gift card, you go to a completely separate website, you enter your information there, it's not connected to your data. But the reason why we collect data anonymously, obviously to give you privacy and what you share, but because we're collecting information on discrimination and things that are really important for us to understand and for decision makers to understand, we ensure that you have utmost privacy in the data that we collect, and it's in secure places and not connected to anything identifying.
So would you agree that as a nation as a whole, that we don't really take dental care as seriously as we should? And then healthcare in general, more than basically for the most part, but particularly dental care. Because we don't really go to the dentist until we have pain or a problem. Until that tooth is about to explode, that's when we start going to the dentist. So what are some things that we should be doing as citizens, as veterans, in order to improve our dental care so we don't get there?
Yeah, that's a great question. So I think as citizens, we should be prioritizing talking to our policymakers about giving everybody effective healthcare coverage, right? So it's a lot easier to go see a dentist whenever you feel like you can afford it. But then outside of those dental visits, obvious things like brushing your teeth, ensuring you're using fluoridated toothpaste, and then ensuring that you are eating foods that are nutritious. These are really, really easy ways to keep yourself healthy and to keep up your oral health. But I feel really, really passionate about ensuring that veterans and all Americans can afford their health care, can afford good nutrition. And really, that's up to policymakers in the end to ensure that that's happening across the board.
Is gum bad for your teeth?
Gum?
Yeah.
You know what? If it's really sugary, it's usually not good for your teeth then. So if you do like to chew gum, I like to chew gum personally. So if you do like to chew gum, just ensure it's sugar-free. And xylitol gum actually can be helpful for your oral health.
There you go from the expert. That is some great information, and also something we want to revisit and kind of get more information about because it's so important to understand this issue. Dr. Annaliese Cothron, she's a co-founder and executive director of the American Institute of Dental Public Health. She manages the program fund development and overall strategy for the AIDPH. Thanks for your time once again, and also like to have you back.
Thank you. Happy to be here.
This is America's Heroes Group. We'll be right back.
Welcome to America's Heroes Group, with information and resources that's disseminated intentionally to empower our military population, with host Vietnam veteran Cliff Kelley, co-host Iraq veteran Colonel Dr. Damon Arnold, and co-host Army National Guard veteran Sean Claiborne. And now, America's Heroes Group.
We have in our chase bags, we have a care package of hygiene, we have shaving equipment, we have razors, and for the women we have the same personal hygiene items for them as well. And we want to say thank you for their service. This is Chase Bank. Thank you very much.
People in the neighborhood, free haircuts, the service, and food. A
Welcome to America's Heroes Group. Hear your voice where we connect the disconnected intentionally.
Who is Cliff Kelley, the governor of talk radio, the icon of radio throughout the world.
Chauncey Spencer II and I, again, share a special relationship. His late great father, Tuskegee Airman Chauncey E. Spencer, took me as a child on my first airplane ride.
Wow.
Yeah.
This is something that people need to see. Often we don't, do the things to show how great our people are. It changes the paradigm of how people think about us, about the collective consciousness of what it means to be us.
And we've been having great conversations about trying to get more African Americans into aviation. And we got a bill that we're trying to get passed that would allow the Pell Grant to be used to help finance aviation education.
This is where I started with this entire conversation by saying, if it were not for America's Heroes Group, I would have given up. So I want to get all my accolades out the way on behalf of America's Heroes Group. Ms. Glenda, thank you. Thank you for encouraging me to press on. I would encourage you all to support this organization. One thing for sure, America's Hero Group is out there. Ms. Glenda will take the time. Ms. Glenda Smith will take the time to listen to you and to steer you in the direction that you need to go.
Thank you for watching another episode of America's Heroes Group, where we provide education about resources and information for our veterans, military, and their family. Thank you for watching another episode of America's Heroes Group, where we provide education about resources and information for our veterans, military, and their family. Welcome to America's Heroes Group, with information and resources that's disseminated intentionally to empower our military population, with host Vietnam veteran Cliff Kelley, co-host Iraq veteran Colonel Dr. Damon Arnold, and co-host Army National Guard veteran Sean Claiborne. And now, America's Heroes Group.
We have in our chase bags, we have a care package of hygiene, we have shaving equipment, we have razors, and for the women we have the same personal hygiene items for them as well. And we want to say thank you for their service. This is Chase Bank. Thank you very much.
People in the neighborhood, free haircuts, the service, and food. Look good.
Thank you for your service. Thank you for your service. Thank you for your service. Thank you, Okay.
On behalf of Cliff Kelley, America's Heroes Group, we sincerely thank Chase Bank for coming where it matters to help homeless veterans have a hot meal today and a care package. We are sincerely grateful for this partnership. Yes!
Welcome to America's Heroes Group. Hear your voice where we connect the disconnected intentionally.
Who is Cliff Kelley, the governor of talk radio, the icon of radio throughout the world.
Chauncey Spencer II and I, again, share a special relationship. His late great father, Tuskegee Airman Chauncey E. Spencer, took me as a child on my first airplane ride.
Wow.
Yeah.
This is something that people need to see. Often we don't, do the things to show how great our people are. It changes the paradigm of how people think about us, about the collective consciousness of what it means to be us.
And we've been having great conversations about trying to get more African Americans into aviation. And we got a bill that we're trying to get passed that would allow the Pell Grant to be used to help finance aviation education.
This is where I started with this entire conversation by saying, if it were not for America's Heroes Group, I would have given up. So I want to get all my accolades out the way on behalf of America's Heroes Group. Ms. Glenda, thank you. Thank you for encouraging me to press on. I would encourage you all to support this organization. One thing for sure, America's Hero Group is out there. Ms. Glenda will take the time. Ms. Glenda Smith will take the time to listen to you and to steer you in the direction that you need to go.
Thank you for watching another episode of America's Heroes Group, where we provide education about resources and information for our veterans, military, and their family. Thank you for watching another episode of America's Heroes Group, where we provide education about resources and information for our veterans, military, and their family.
And welcome back to America's Heroes Group, our roundtable with our partner, Women Have a Voice. That is with Deborah Denhart. Saturday, October 15, 2022. October is Breast Cancer, Mental Health, National Disability, and Domestic Violence Awareness Month. Our host is Cliff Kelley. I'm Sean Claiborne, the co-host, the Army National Guard veteran. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And as I mentioned, we have our partner, Deborah Denhart. She's a U.S. Air Force veteran and marketing, communication, public relations professional. And we have a new segment we want to go introduce it, which is called Women Have a Voice. Now, I'll give you some information about Deborah. She's a marketing, communications, and public relations professional, we mentioned. She has worked with the International Trade Administration, the VA, the FBI, senior government officials, and was the host of her own television program for 8 years. She's also an artist and a writer and is currently writing a book, which will be published in 2023. We're looking forward to that. How you doing, Deborah?
I'm doing amazing. How are you doing, Sean?
Pretty good, pretty good. So tell us about this new voice you want to bring to America's Heroes Group. Tell us about Women Have a Voice.
Yes, so very excited about this new program. And how it came about was I was talking to Glenda, your executive producer, and she had mentioned she would love a platform where it would be focused just on women. And when she said that, I couldn't believe it, because I literally was thinking the same thing. I was going to start a podcast of my own to empower women, and I had never told her this. And she'd mentioned this program, and I thought, oh, this would be amazing. And I just thought, wow, what a great opportunity to just focus on women in one venue.
So what are some of the barriers that women face in getting their voices heard and their stories told?
You know, there are so many barriers, but, I'll just talk about a couple. So just an example, and I've talked to other women who felt the same way. I was in a meeting with, a team, and I mentioned an idea during the meeting. And about 5 minutes later, the manager of our group mentioned the exact same thing that I did. And everyone was like, oh, that's such a great idea, And I thought, I just said that 5 minutes ago, but no one heard me.
I've seen that happen so many times in meetings of
yes.
It's like
right?
it's one of those most comical things where one person will say something, and then another person will say the exact same thing, literally say the exact same thing, and all of a sudden it just has so much more merit.
Right, exactly. Yes, and I've talked to other women who've said the same thing. Like I said it in a meeting, and then a male, mentioned it, and suddenly it was just such a great idea, and so that is something, just having your voice heard and not being invisible, and just being able to receive the recognition for whatever it is, whether an event or an idea, to be heard, basically, right? Women have a voice, so that's what the forum is about. And then another area is, some women are parents, right? So I'm personally a single divorced mother. So raising my kids, it was always a challenge, trying to find organizations that would be willing to be flexible. I had to take my daughters to doctor's appointments and get them to school. And, they had health issues as well. So there was like all of those things, those pieces. So it was very interesting. And you kind of find jobs or positions during that time that are flexible enough that you can leave without being fired, So that's another barrier, making the workplace a little more accommodating to mothers, and for companies seeing the value of their female employees, and what they can bring to the table, and reducing some of those barriers.
I think really, if we want to do something for the economy, for this nation to help really make GDP go up, but also help the economy be stronger, if we created more attention around childcare. So particularly for single mothers and even married couples, childcare is extremely expensive. We don't really think of how the idea of in today's America, we have to have two people working in a household. It's very difficult if you're middle class to or even lower middle class, slightly above middle class, even in some neighborhoods, to make ends meet without feeling like you're bitch treading water if you have to take care of children and pay for childcare.
Absolutely.
So if we could just get that under control, that would be such a benefit to this country.
It would absolutely. I know I've heard about companies that are actually incorporating, in their new companies, they're building childcare facilities for the mothers, because they value their female employees. They don't want to lose them because they have children,
Right.
because women will make the choice. It's either, well, I stay home or I have to put my child in childcare, which is such a heart-wrenching thing to have to do.
And expensive. It's extremely expensive. People paying $400 a week. You're making $35,000, $40,000 a year, $60,000 as a household, and you're paying $400 a week, $600 a month on childcare.
Yes, absolutely. And so a lot of people make the choice of, well, I'll just stay home. It's cheaper for me to stay home. But so that mother will lose some of the value of being maybe in the workplace, or, so those are all those kind of, barriers that, we're facing as parents. We feel like we're bad parents. I have to leave my child in daycare. Like you said, it's expensive. It literally is, like another income. So you have to kind of make those choices. So a lot, more companies promoting and valuing, again, their women employees and incorporating ways that they can still work to not pay those exorbitant, prices for childcare would be amazing. You're absolutely right. Absolutely.
I really appreciate writers like yourself, because writers are thought leaders, in my opinion. So when you're writing some of the things you've written in the past, what are some of the topics and some of the ideas you wanted to promote? And what things or subjects are you really passionate about when it comes to women's voices?
I feel really strongly that, just helping women overcome struggles, challenges, like I said, I was a single mom. I'm a single mom, a divorced mom. So there's a lot of challenges involved in that, and being, raising your kids and making the choices that you make, and you make them for your children. So I'm really passionate about just kind of sharing struggles and stories of, how we've overcome and the struggles that we've been in, and what can we do to overcome those. I think that's so important when you're encouraging other women. So I love to write about things like that and use that as a platform to just kind of give a voice to all of us as women, and so that's really important, sharing our struggles, the struggles of, being a single parent, or, the struggles of your children with healthcare needs, or, just finding your own voice as a woman, where am I going? What's my purpose? We get so lost as women sometimes in other people, because we're givers, We want to give all the time, and I think we lose who we are. So I think it's important as women, to remember our voice. Like, what do we want to say? What is our purpose? Finding that is so important too.
So tell me about your experience in the Air Force. So you were in the Air Force. You're a woman veteran. How did the Air Force shape your ideas of today, and how did it change you from when you went in, presumably when you were maybe a teenager, possibly early 20s, whatever, like most of us, and then how did it change you through that experience of going through all the stuff that you see and hear in the military, particularly as a woman?
Well, when I first said that I was going to join, everyone around me said, no, it's horrible, you're going to be treated terribly, and it's just a bad experience. Like, I had so many negative comments and people telling me negative things. I did have, I was familiar with the military. My father was in the Air Force for 24 years and traveled with him on different assignments and things like that as a family. So I was familiar with kind of the military pretty, from my family growing up. So going in, I thought, oh, okay, I don't know what to expect because everyone said it was so horrible. And I really found it to be just a great place to learn. I was in the medical field, and I was stationed in Germany and Turkey, New Mexico, and I found it to be most of the time really awesome, for me personally. But I was in the medical side, so I was in the hospital working with doctors and nurses and, that type of thing. But there were times when I think you as say you have, I worked with colonels and, majors because they were physicians. Sometimes you were treated, inappropriately. And I think our mindset in the military is, someone's of higher rank, so I can't really say anything about, how I'm being treated. Like one time, someone whistled at me while I was walking down the hallway, one of the doctors. But then I didn't know, I didn't realize, that's not okay. Mm-hmm. And I can say something.
How did you feel at that time when you heard that whistle, if you can remember?
I felt, a little just kind of shocked, that this professional doctor that we did, a C-section with, is saying this, or doing this. And so you're just kind of like, I don't know how to, this is so wrong, this is so inappropriate. But he laughed it off, that type of thing. And I know now, I think it's just knowledge that, you don't have to put up with that kind of behavior. I don't care what rank someone is. You are, deserve to be treated with respect and valued. So I think that's really important, to know that even in the military, also outside of the military, leaders who, we should, the minimum, be treated with respect and respect, in your tone, in your language and behavior.
But one of the things I think is when it's going through people's minds today, particularly men, I think men are now, because of the Me Too movement, because of lawsuits, because of we've seen men of power, men of position lose their careers, lose their jobs, who have been around for years. I mean, looking at just what happened with Bill Cosby, with R. Kelley, looking at celebrities like those guys who have done horrible things to women, fall, and you would think, nope, those guys are untouchable, so to speak. I think men are just more scared now, but I don't think they've changed at least for the generations. I can't speak for Generation Y or the kids coming up today, and maybe the culture has changed. But for the men my age and slightly younger and slightly older, particularly definitely older, it's more of the fear rather than changing of the mind or the mindset as to what's appropriate, what's not appropriate. Men still have those desires. They still may talk in secret. They just don't let those things out in the hallway anymore. They're not doing the catcalls anymore, but they're still saying it in the bathroom or at the water cooler or whatever amongst other men. What do you think needs to change in order for people to understand that it's different when you are the one being targeted versus the person who's just doing the catcall?
I think it's important for them to, it's a culture, right? We have to change the culture, the mindset. Like you said, some men think, oh, that's, what's wrong with that, right? And I think it's education, realizing, you are really showing that person the lack of value, in those actions and disrespect. And that's not appropriate. So I think that's really important to stress to those people who think that, that's okay or there's nothing wrong with it. I'm not saying it, but I don't think there's anything wrong with it. How you make that person feel and how devalued they feel when those things happen. So I think that should be on the forefront, and just educating and not, thinking that girls like that, because they don't, it's not something they're looking for. They don't want to be treated that way. They want to be treated with constantly, I always say, with respect. That's the minimum. Again, that is the minimum.
Do you feel that there's some women out there do you encourage those type of behavior though, because they want the attention or whatever it might be, or they might have a different mindset?
I'm sure there are, but I think, overall, shouldn't we all be treated with respect, even if that person maybe doesn't value themselves enough to ask for that? I think that, as people, as a culture, I think we should, always treat everyone, with the utmost respect, no matter what position they are in an organization, whether you're the janitor. This is my philosophy. I've always thought I'm going to treat everyone with the same amount of respect and value as, from the head, from the top of the organization to the janitor, housekeeping, because we all deserve that. And, I love what Maya Angelou says. She says, people won't remember what you did or how much you own your possessions, but they will remember how you made them feel.
Yes, definitely. Yeah. I think that a lot of men, particularly the older generation, and my generation even yet still, I think a lot of guys in my age group don't really understand that respect part. They don't really necessarily see it as disrespect. They see it as almost flattery.
Right. So that, again, it's a mindset, it's not flattering. It's, you're treating someone like an object and not like a person, that they, the person that they should be treated as, and valued. Again, it's not a commodity, but it's a person, with feelings and, just seeking, I think women, we just want to be heard. We want a voice at the table. We want people to be when we do say something, to be recognized in what we're doing, and just I really believe this is going to be just a great platform for us to just encourage each other as women, and men will be listening too, and I hope they gather insight as well, maybe, in what you're saying as far as like changing the mindset of what's appropriate and, what is acceptable. I look at life kind of like as a rugby game. My daughter, when she was a junior, wanted to play rugby. And she, after looking at what it is, as far as like it's football without the pads. And when I went to the game,
football without the
without
pads.
the pads.
Okay.
It's football without the pads.
Yeah, exactly what it is. Yeah. And ironically, from what it seems like, people in rugby don't get hurt as much as people that play NFL football or football in general.
That's interesting. Yeah. So I would go to the games. Both my daughters ended up playing rugby, and I kind of watched them, and I thought they get hit, they get tackled, and they get back up every time. My daughter, the first time, she had a black eye, and she had cuts all over from the cleats, and I went, oh my gosh, are you going to still play? She said, yes, I love the game. My younger daughter, the same thing. Like every time she'd go play rugby, she would throw up at every game. Sometimes it was on the field, and I would go, are you going to sit this game out? She's like, no, I'm not sitting the game out. I want to keep playing. And so I just think, oh my gosh, and then they would, someone would pick them up and, kind of like help them up. But every single time, and we've had fractures, we've had bruises, we've had broken noses, broken hands. But it's the love of the game, the passion for that. And I think of life that way in a lot of ways, to make a goal, you have to score a try. It's called a try to goal, to get the goal. And so I look at them, and I was so inspired watching them play rugby. And I think, it's like life, we're knocked down as women. We're knocked down, some people play dirty, they'll knock you with their elbow, try to knock you out. And you just have to keep getting up. You have to keep getting back in the game, and it's hard. You get bruises, you get hurt, but you just don't give up. and you just keep getting back in the game. And I just hope that, just like the player who reaches down for someone and, picks them back up when they've been knocked down or tackled, women have a voice, we're part of the team. Let's help you up. We're going to be the ones to give you resources and encouragement and empower you to just keep getting back in the game.
So tell me more about Women with Have a Voice, the idea, the program beyond the scope of the radios. What do you guys do as far as contacts? What do you guys do in the community? Do you have other things planned for the organization?
Well, we're looking at a possible television program. As far as outreach, we have, it's just beginning. It's something new. So we're really just kind of coming to life now. And it's blossoming. This is our first program, so really excited. And, each month we're going to have a segment. So it's going to be very exciting.
So what do you do every day to empower yourself?
I have affirmations that I read every day because we have so many negative things coming in all of the time in our heads, and so I try to put positive things in. So those voices that are telling me I'm not good enough, or, I need to be more, or whatever that is, I try to use those affirmations. And I also read the Bible, and I also listen to positive podcasts and that empower me, that I can hear other people's struggles. And that actually also motivated me, listening to all these podcasts that I listened to have a podcast, or to have a forum where you can share ideas and encourage other people. And so, yeah, that's what I do every day.
Wow.
So I try to do every day.
When you get your show, you got to have us on the show, have America's Heroes Group go on with you, to give you some support and also give us some shout outs and things like that. And we're glad to have you on as America's Heroes Group partner because, that's something I think is really important to communicate to the public. We got to make sure that we are doing things to try to get everybody's voices heard, and particularly in the veteran community, because we are for the veteran, about the veteran, are by veterans. And, we put our time and effort in to try to get an information across that the civilian world may not always be aware of. And it's not just something that helps veterans, but also helps the country as a whole. So I think through the veteran community and through what we do at America's Heroes Group and organizations like yours, we can bring more information and some solutions to help some of the problems that every American faces in this country, and possibly even we could be an example to the rest of the world.
Absolutely. Absolutely. And for our women listening and everyone listening, I just want to remind them that you are beautiful, you are brave, and you are enough, and keep getting in the game.
So there you have it, ladies and gentlemen. Deborah Denhart, she's a marketing communications, public relations professional, and she has a new program on America's Heroes Group, Women Have a Voice. This is America's Heroes Group, and we'll be right back.
Welcome to America's Heroes Group, with information and resources that's disseminated intentionally to empower our military population, with host Vietnam veteran Cliff Kelley, co-host Iraq veteran Colonel Dr. Damon Arnold, and co-host Army National Guard veteran Sean Claiborne. And now, America's Heroes Group.
We have in our chase bags, we have a care package of hygiene, we have shaving equipment, we have razors, and for the women we have the same personal hygiene items for them as well. And we want to say thank you for their service. This is Chase Bank. Thank you very much.
People in the neighborhood, free haircuts, and service and food. Look good. Thank you for your service. Thank you for your service.
Thank you for your service.
On behalf of Cliff Kelley, American.
And welcome back to America's Heroes Group with our roundtable and our partner, National Nurses United. Today is Saturday, October 15th, 2022. October is Breast Cancer, Mental Health, National Disability, and Domestic Violence Awareness Month. Our host is Cliff Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have our partner on the line, Miss Annaliese Marshall. She's a Veterans VA Mental Health RN, registered nurse. She's going to talk about the November elections and also some of the things we've been having. We had some support. She's had some support with the National Nurses United from Senator Sherrod Brown and Representative Mark Takano. Both support National Nurses United and the VA Employee Fairness Act. And we want to talk about that and how that is important to veterans around the country. How are you doing today?
I'm good, and thank you for having myself and NNU on this show today and allowing us to share important information with our veterans who are in your audience.
So how did these two government officials get behind National Nurses United to promote some of the things and issues that you guys are concerned about, particularly when it comes to the VA Employee Fairness Act? Because we know from previous shows we talked about that there is a problem with the way nurses are treated in the VA system. Lack of support, crazy hours, not necessarily getting the proper equipment, being overworked, all kinds of different issues. So tell us what they see and why they're supporting you and how they got to support you.
Well, they introduced this bill once they start gaining knowledge of the impact that this bill was having on recruitment and retention of nurses, and not just nurses. This also include doctors, physical therapists, dentists, dental assistant. In this group, we're referred to as Title 38 employees. Other employees are Title 5, but we're more restricted being a Title 38. This also includes eye doctors, chiropractors, nurse anesthetists, physician assistants, and extended function dental auxiliary. And we're prohibited from negotiating over matters such as professional conduct or competency, peer review, or changes to employees' compensation. As we know, there's a critical shortage now of these personnel, and especially nurses. And many hospitals, including the VA, has problems in recruiting professional staff who is really needed, the eyes and ears of our patient, and at the VA, we're the eyes and ears of our veterans. And so we're constantly short-staffed. Within a few days ago, someone alerted me that one nurse was covering 2 units and had another staff member that was not orientated or trained to work on that unit, and they're just juggling everything. And we are limited as to what we can say regarding these issues. So the bill in the House is 1948, and in the Senate is 771. These bills, if passed, would not allow federal employees to strike. All it would do is give us fairness at the bargaining table. If you go to any of the hospitals here in the Chicago area or in the country, private sector, they have that right. But for us at the VA, we do not have that right.
And that is the right to strike, right? Is that what you're speaking of?
Right. We wouldn't. They have the right to strike, but we would never have that right to strike as a federal employee. We would only have the right to come to the table to talk about recruiting and retaining top talent to the VA. And we already started as a deficit before COVID even hit. So we lost many nurses to retirement. We're looking at 2025 already, trying to anticipate how many nurses will be leaving the field with retirement or finding other positions in other areas that will pull these nurses from the bedside. So we need incentives to bring them to the VA. We want top talent for our veterans. They have given their lives, they have given limbs, they have given their mental health to this country to make things better for all of us. And if there's no one there to advocate for them, who will? So we do ask that Congress and the Senate look at this bill and pass it and give us the opportunity to bring talent, very good talent, to the VA. Some of our nurses, for example, they'll go to the agency. The agency may be paying double or triple their pay or 2.5 times their pay that they're making at the VA. We understand that, they won't be getting maybe benefits in exchange for that, but we do have to bring our nurses and other critical care employees up a little bit from where we stand now. We are so short. I mean, I cannot even. We're critically short. To at a point, if it was private sector, they would close some of the floors, which many in the private sector are closing floors and are closing hospitals because they cannot get nurses to come in to care for their patients. We don't want to become a desert or a ghost town lacking employees here at the VA. We want to provide the services to our veterans that they have earned and that they have been promised. We don't want them telling them, on one hand, we promise to do this, we're going to take care of you, we're offering you this, we're offering you home health care, we're offering you telehealth, and then when they come to get it, there's nobody there to provide it. We have not yet been replaced by robots. This is a hands-on job. We offer our veterans a lot of support, encouragement, emotional parachute when they come here. We don't just see them and let them go. We nurture them and we care for them. They're like our family. And as in any situation, I wouldn't want my loved one to have to go in the hospital, and that nurse has to make a decision on who's in more pain, who should I take care of first, what child should I look at first when I've got 3 or 4 of them crying. They may be hungry, they may be wet, they may be in pain. So who do I go to first?
So what can be done?
This is not a balancing act.
So what can be done, and what's in the bill to help alleviate or solve some of these problems? Is it mostly more pay and training, or is there other things?
So the bill would allow more training. It would allow more pay. We still would not probably be competitive with private sector, but we are looking for where we can bargain over forms of compensation, award, bonuses, overtime, special scheduling arrangement. Right now, I'll just say all our nurses, I'm not going to even point to our more junior nurses, but they're looking to have more time home with their family. I have one situation where they're denying them being able to work 12-hour shifts. We don't understand why. Because that would cut down.
So
that would help us to cover off tour shifts.
How many hours? What's a typical shift right now?
So in this one particular area, this management is saying absolutely not, just 8 hours. So we cannot cover the off tour shifts with an 8-hour person. If we had 12-hour nurses, they would come in maybe at 7 in the morning and stay till 8 at night, or come in at 11:30 and stay till midnight, or come in at 11:30 at night and stay till the next morning. So we have done this in other areas, and we've just started negotiating or bargaining over some of this, but we still have managers that are saying no, and the staffs are leaving. They don't want to be disrupted from their family. COVID has really made everybody aware of how important their family members are. And our nurses, and many of them are just starting their family. Many of the ones that are older are losing family members, and they want to be there and to spend that valuable time with them, as well as care for our veterans. We're torn.
So how has Representative or Senator Sherrod Brown and Representative Mark Takano supported this bill? What have they said about National Nurses United effort to try to get this bill passed?
Well, they're very supportive. As a matter of fact, they've got over 200 other members of the House and the Senate to sign on to this bill. They realize the importance of the federal workforce in the VA to have a voice in the VA and in the care of our veterans. And they also know that this is important to all the promises and the other programs that Congress and the Senate has passed to help support our veterans. Our veterans are those who have served their time, and they're coming out. And they're coming out to what? We don't want them to come home to an empty house. We don't want them to come to an empty hospital. We want them to come here and know that they're going to be cared for.
So what's the likelihood for success in this, particularly in this type of economy now? Because in our current economy, there is labor shortages everywhere. And we mentioned earlier on this, even on our broadcast just now, we have already acknowledged that there is even a shortage in the civilian sector for nurses. So even if you do raise wages, which is still not going to be competitive with civilian wages, and you get better training, how do you solve the labor gap that's current?
Well, the one thing that I can say, and when I came to the VA, I came to care for the veterans. I could bite my tongue now because I do remember saying, oh, well, salary is not that important. I need to be there to care for them. And I came when the Saudi conflict started. And many of our nurses who come here feel that way. Many of our staff, doctors, nurses, dentists, they are part of the military. They came out of the military and came to work at the VA to care for their fellow vets. So that's a draw. It's an honor to be a federal nurse. It's an honor to care for our veterans. So many of us prefer to be here than to be in a more glitzy surrounding because our job has the purpose. We see our veterans quite often, the same ones, and so they become endeared to us. Where in other areas, you go and you have surgery, they never see you again. You know, you might go to another doctor or another hospital for something else. But our veterans come here. There's veterans who have grown old with me through time. And it's a joy to see them. It's a joy to see that they're recovering. It's a joy to see them in the halls and they're dressed up and they're proud to show me the progress that they've made in their life. And it's a joy on my end to see them and to, you know, give them a nod of having walked that road and now come to their destination of recovery.
So it sounds like that really, if you raise the wages and also provide better training, that perhaps you might be able to retain some of those retiring or service members that are coming out of the military, out of active duty, maybe go into the VA system to try to stop that.
We're trying, yes, we're trying so hard to retain our nurses, but they also have families that they have a responsibility to. And you know what? If I go to one of our stores and an item is, and I enjoy going to that store, and an item might be a few cents or a few dollars more, and I'm treated and I'm welcome there, I will probably go back there and shop. And so it's the same here for our staff. if they come here, they know that the VA is caring for them and allowing us to do our very best and providing us with enough support. We understand that occasionally we might be short. We have some areas where some of the staff, many of the staff members on a unit became infected with COVID and had to be out. We know that. We understand that. We'll pull together for that. But to start off understaffed, severely understaffed, where you can't even get RNs to take orders off for a patient, is very concerning that you don't have RNs. We're the engine of the hospital. The doctors cannot do what we do.
True. That's very true. When you apply to be a nurse, do you apply for a specific location or specific VA medical facility, or do you get put wherever they assign you? Like in the military?
No, you can apply for wherever you want to work. If someone comes here and they don't have the experience, we can train them for an area that they may want to go to. But many of them may come in with specific ideals of where they want to work. I know one nurse, we call her infusion nurse, and she came in to do cancer treatment for our veterans, and now she's going to be starting in November in ICU. Some of them, they're not quite sure what they want to do. Some of them want to be bedside nurses no matter what, and they're not going to leave the bedside. Others may eventually want to work from home and do telehealth, or work in the clinics, having more or less kind of a 9 to 5. But we're trying to get the clinic hours extended so that our patients who are now working can come here before or after work. And by giving the nurses alternate work schedules, then we can have coverage for them to come in up to maybe 6 o'clock at night or something. Right now our clinics close about 4:30.
Wow, that's early.
That's early, and if you're working,
right, get off work
and with the traffic and all of that, I mean, we should have later hours to accommodate our veterans.
What time do
we
they
are
open?
extending our women's health clinic.
What time do the clinics open?
Pardon?
What time do the clinics open?
7:30.
7:30.
7:30. Wow. Mm-hmm. We have nurses that would like to come in at 6, and that way they can get all the paperwork done and then be ready, to see the patients and stuff timely, instead of taking time away from patient care to do paperwork and stuff that we have to do. Our paperwork takes a long time to complete. Our computer system could move a little bit faster. So there's a lot of variables in the nurses being able to complete their care for the vet. I mean, many times we can't even take lunch. We're working through our lunch hour. That's a sign that you do not have enough nurses to cover your care.
Wow. The reason why I brought that up is because there's there's a disparity amongst the VA medical centers across the country. There's a rating system. If you go to the VA website, you can look up your local VA hospital and see what the rating is. It goes from like 1 star to 5 stars. And there's a lot of facilities around the country that have, pretty good care, but there's also some places that are known for some horror stories.
Well, that's true, but the one thing about the VA, we're transparent. You go to private sector, all of that's not reported. One thing about the government, everything is reported. And we have a lot of eyes on the care that we produce for the patients. We have a lot of other departments that monitor what goes on to the VA. And if our patients aren't satisfied, they get a form in the mail that they can check off, if they're satisfied or not. But one thing that leads to dissatisfaction is a long line. That's in anything. Yeah. People want to get in. They got things to do. We need to see them. The only way we can do that is to have adequate staff.
That's true. But I also think if they can get behind and try to improve or have a system to improve some of these troubled or struggling VA medical facilities, like the one in D.C., for example, had notorious, I'm not sure how it is today, but notorious stories.
I can honestly say this, that I believe our director here at Jesse Brown, I'm speaking the truth, is our visibly, if you come here, you will see changes here. And I'm proud to say that. However, there are things beyond what he can do, and that is recruiting the staff to come here.
Mm-hmm. I've always liked the care at Hines and also at Jesse Brown. I've always thought that because I've taken veterans there. I haven't gotten care there myself because I have private health care, and then also I'm a National Guard veteran, so I don't get the same benefits as someone who's been active duty or been deployed. So the thing I've seen is that the care has always been very good, and they've always been patient and caring, and it's very expedient compared to what I've seen in the civilian world here in Chicago. But other places around the country, there needs to be a system to try to get or at least share some of the success stories that we have here in Chicago with places around the country, so they could bring some of these struggling medical centers up to par. Because there's still that push out there. There's still language out there, particularly in Congress, to privatize the VA system, to kind of wind it down, to have veterans go to civilian care.
But that, I think, would result in lesser care, because some of the things I hear, trying to get equipment for the veterans and things like this, it could be a nightmare. And without the dedicated employees that we do have, there are a lot of things that probably wouldn't go as smoothly as we make it go now. But the shorter the staff, the harder it is for us to produce that level of care for our veterans.
So what do you want veterans to do across the country? What can veterans do and civilians do to,
we would love for the veterans to be involved in this, to contact their congressman and their senator in the areas that we are reaching through this podcast, to let them know that they should pass this bill, House 1948, and the Senate Bill 771, Senate Bill 771. Encourage them to pass the Employees Fairness Act. We're still working without a contract since 2012. Our contract has not been signed, but we're still producing the high level of care for our veterans. The contract is very important to us, but it doesn't exceed the concerns that we have for our veterans. And we want to make sure that they're cared for. And this bill would allow us to bring in, better experienced nurses. Everybody's vying for that, even over education. The experience that we bring to the table is very important when you're seeking care anywhere. So, we're reaching out all the communities. We need Hispanic nurses. We need nurses from every race in America, every nationality. We need them here because our veterans have come from a lot of nationalities, and we need them to be see people who are like them to care for them.
I would really love to see more telemedicine, getting more nurses in to get telemedicine up and it's already up and running, but to get it more expansive, so that way people in rural areas, people that don't live close to a facility or close to a clinic or a medical facility, that they can get the care from VA treatment, particularly with all the new cases coming on. We just talked about burn pits. We just talked about a lot of the legislation has passed for people to get treatment for toxic exposure. So you're going to have a lot of questions, a floodgate of people coming back from Afghanistan or from Iraq who have questions and concerns about their health and who are going through a lot of confusing stuff. Their bodies are changing in ways that they never thought was even possible.
Right, just like the president just addressed the burn pits. that our veterans were exposed to, by being stationed over in the Middle East. And there are other health care that's associated with just being around, being in the desert environment and stuff. So we need staff that's going to be trained for that. We have one training right now that takes 8 hours to complete, and we're just saying we want to do this training, but how do we pull people from the bedside to get this training done? Because we're so short, we cannot lose one person.
Wow. Ms. Alina Marshall, we appreciate your time. We're running out of time, so we got to come back to this topic and really get to the bottom of what's going on with this. And hopefully we'll go online, veterans, go online, civilians, and see what's happening with the VA Employee Fairness Act, read up about it, get your support behind it. Thanks for your time, Adelina.
Thank you very much for having us. And I encourage all our veterans and listeners to vote.
America's Heroes Group totally supports National Nurses United and both bills that's needed. Without a nurse, you don't have a hospital.
That's right.
Thank you to all of our partners today. Great jobs, great shows. Hines VA, yeah. Community outreach with our new partner, America's Institute Dental Public Health. Our third new partner, Deborah Denhart. Women, yes, we do have a voice. And the fabulous National Nurses United. We appreciate everyone, and thank you especially to our viewing, live stream, Facebook, YouTube audience, because you make us global. Thank you so very much. To our technical producer, Justin Young, great job today. Woo, 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 woo. Our technical digital media producer, Ivan Ortega. One of the best co-hosts America's Heroes Group has ever had, Sean Claiborne.
Do what I can do.
You doing it, sweetheart. You making it happen. Please feel free to call America's Heroes Group at 312-803-2618. We're located at 155 North Wacker Drive, Suite 4250, regarding questions and concerns of America's Heroes Group. On behalf of the one and only, the man, the voice, the legend, Cliff Kelley, Colonel Dr. Dana Arnold, Sean Claiborne, America's Heroes Group, have a blessed weekend. Get vaccinated.
Thank you for watching another episode of America's Heroes Group, where we provide education about resources and information for our veterans, military, and their family.